I'm Rish Baiju. I'm the director of Luxor. We have dedicated an operational research training to climate, environment and health, or at least the thematic of that, because we see the impact of climate change in our projects, but we also see that the populations we work with are often more higher at risk for the impact of climate change. Hence it is important that MSF gets better in how we collect that evidence, how we analyze that evidence, and basically how we advocate on that evidence as well. So operational research is important for the thematic climate, environment and health, because at the moment different studies have shown that we still lack sufficient evidence on the impact of climate change, for example, in humanitarian context. Operational research can help us collecting more systematically these types of data, systematically analyze them, and therefore also advocate on what the impact might be in humanitarian context, the added impact, I have to say, on often vulnerable health systems, but also how we can equip ourselves better to deal with that impact and to help populations and the communities we work with on a daily basis better. So to generate evidence systematically, we also of course need staff that understands, aside from how to treat a patient or how to roll out medical interventions, on how to conduct operational research. What are the good standards on collecting data, for example? How do you analyze the data? How do you write a scientific report or a manuscript? But also when you do research, there are certain procedures you have to keep to. For example, if you do research with our patients and populations, basically with humans, you need to get ethical approval. And it's important that researchers in MSF or people who want to conduct research in MSF are familiar with all these facets of doing research.
My name is Maria Ten Palomares. I'm the Climate, Environment and Health Program Manager at MSF OCB, so Brussels Operational Center. We struggle to really translate what does it mean operational adaptation for the missions, projects and regions. What does it practically mean to our field teams? And I think this training, it sheds some light on that. Very practical examples on what are the specific adaptations that we need to do in order to adapt to climate change and environmental degradation. And we could see that in many different ways because the research is very diverse. So we could see from surveillance, from water resource management, from community engagement, what are the different tips that we can have in order to face this new reality. We already see the effects of climate change and environmental degradation in the places where we work. Us, as MSF, we are a medical humanitarian organization, so we're an emergency response organization. So if we really want our operations to remain fit for purpose, what does it really mean to adapt? Do we need to do prevention? Do we need to do community resilience? Do we need to think about a bit on longer term instead of shorter term? So all this, we still need to reflect on what is our place, what is our role that we want to play. Also knowing that at the same time and in parallel, the medical humanitarian emergencies are increasing, regardless of climate change. Climate change is a contribution factor that makes these emergencies go in much more dangerous, no? So, yeah, how far do we go in terms of all the crises that we will face at the same time? And also, on the other side, as one of the key debates is how far do we go also on the fact of reducing our environmental footprint? Because if we want to operate in the places we operate, we know that we need to have indeed a carbon footprint. But what does it really mean to reduce it, and how can we make this reduction worth it, knowing that we will use less resources?